Ever wondered about the silent protagonist in your body's stress response story? The unsung hero, cortisol, is a hormone produced in your adrenal glands. It plays a key role in regulating numerous bodily functions such as blood sugar levels, inflammation reduction, metabolism, and memory formation. While a balanced cortisol level is essential for health, an excess can lead to complications. High cortisol levels may present themselves through a variety of symptoms. These can include weight gain, especially around the back and face, acne, thin skin, easy bruising, redness in the face, delayed wound healing, and muscle weakness. More subtle signs might be constant fatigue, irritability, and concentration issues. Elevated blood pressure and headaches may also be indicative of high cortisol levels. One condition associated with excessive cortisol is Cushing syndrome, where the body produces too much of this hormone. Symptoms include fat deposits, purple stretch marks, slow wound healing, and thin skin. Now, what could possibly cause high cortisol levels? Stress is a major culprit. Chronic stress can lead to prolonged high cortisol levels, disrupting numerous processes in the body. Pituitary gland issues, which regulate hormones, may also result in excessive cortisol. Adrenal tumors can secrete cortisol, causing Cushing syndrome. Certain medications, such as corticosteroids and oral contraceptives, can raise cortisol levels. Lastly, high estrogen levels, like those during pregnancy, can increase cortisol levels. If high cortisol levels are suspected, diagnostic tests may include urine and blood tests, saliva tests for cortisol, and visual tests like CT scans or MRIs. Uncontrolled high cortisol levels pose serious risks. They can lead to cardiovascular diseases, osteoporosis, insulin resistance, and diabetes, and mental disorders. Therefore, if you're experiencing any of these symptoms, it's crucial to seek medical attention. These symptoms can be common to many conditions, so it's vital to get a proper diagnosis. There are also additional methods to lower cortisol levels. For instance, dynamic neurofeedback, a technique that optimizes brain function and reduces stress, can be beneficial. Do remember, the information provided in this video is not a replacement for professional medical consultation. Always consult with a healthcare provider for accurate diagnosis and treatment. To recap, cortisol is an essential hormone that, when in excess, can lead to health complications. Symptoms can range from physical changes to psychological disturbances. Causes can be as varied as stress to pituitary gland disorders. Diagnosis involves a series of tests, and uncontrolled high cortisol levels can lead to severe health risks. Therefore, seeking medical attention is essential if high cortisol levels are suspected. Remember, our bodies are intricate systems, and understanding them is the first step towards maintaining good health.